Welcome to pediatrics. So our topic for today is prematurity. Prematurity, this is a problem of a newborn. Okay, this prematurity, it accounts for the largest number of admissions in your neonatal intensive care unit. You're going to find that preterm babies have an increased risk of infant mortality rate in the first year of life, with most of this occurring in the first month of life. Now, the earliest gestation age at which the infant has at least 50% chance of survival is referred to as the limit of viability. Let's look at the definition of prematurity. So prematurity is a pediatric condition or a neonatal condition, it's just the same thing, in which a baby is born after 28 weeks of gestation but before 37 complete weeks, calculated from the first day of the last normal menstrual period, characterized by a large head in proportion to the body, or you can say characterized by a weight of 2.5 kg or below, or you can say characterized by widely spaced sutures or fontanelles, that is still okay. Now when it comes to prematurity, you're going to find that a premature infant is one that has not yet reached the level of fetal development that generally allows life outside the uterus. In a human fetus, several organ systems mature between 34 and 37 weeks of gestation and reaches adequate maturity by the end of this period, that is by the end of the 37th week. Now, one of the main organs mostly affected by premature birth is the lungs. So prematurity can be reduced to a small extent by preventing preterm birth. Okay, let's look at the predisposing factors, those factors that can cause prematurity. Now, the causes of premature labor remains elusive, but you're going to find that most research has pointed out 4 different pathways that can result in premature labor. One of them is precocious fetal endocrine activation, uterine overdistension, decidual bleeding, intrauterine inflammation or infections. Now, activation of one of these things that I've mentioned or more may cause gradually or may happen gradually over weeks or months. The factors that you're seeing on your screen there have been identified or to be associated with preterm birth. These factors are maternal factors, the fetal factors, the placenta factors, and the iatrogenic factors. So let's look at these factors one by one so that we know how they can result in a premature baby. Let's start by looking at the maternal factors or the maternal related factors. Under the maternal related factors, you're going to find that when you do a history, when you take history from the mother, there is going to be history of termination of pregnancy. Okay, history of termination of pregnancy. This history of termination of pregnancy or abortions can weaken the uterus, which can result in premature birth of a baby. Okay. Then under the same maternal factors, we have cervical incompetence. Cervical incompetence, this is where you're going to find that the cervix of this mother cannot sustain pregnancy. So as the pregnancy grows, the cervix opens, and when a cervix opens, it prematurely exposes the baby. So now, as a result, because the cervix is incompetent, it is unable to sustain the pregnancy, and it is opening before the 10, that is the 37 weeks. It is opening before 37 weeks of gestation. Therefore, the cervix is incompetent. Okay, another maternal factor that we can talk about, maternal illnesses, specifically severe illnesses such as tuberculosis, HIV, STIs, malaria, anemia. Now, all this can result in a mother giving birth to a premature baby. Let's take, for example, malaria. When you look at malaria, there is increased hemolysis of the red blood cells, meaning there is going to be reduction of red blood cells in number, resulting in reduction of oxygen supply to the baby. So now, for the body to compensate for this action, or for this problem, what it is going to do is it is going to expel the baby because of the insufficient supply of oxygen to both the mother and the baby. That is on malaria, specifically severe malaria, because we're looking at the severe maternal illnesses. Then also maternal age. Now, when you look at the maternal age, you're looking at the outside optimum childbearing age, which is below 18 years and above 35 years. So when you're looking at a mother who is below 18 years of age, you're going to find that they have a uterus which is not developed, and thence that uterus cannot sustain pregnancy, and it will result in a premature birth of a baby. And now when you're looking at the age of 35 years, above 35 years, that is the maternal age above 35 years. The maternal age of about 35 years will result in a premature birth, because at this point the uterus is weak. That is why there's going to be a premature birth. I'm not saying that any mother or any woman who is pregnant below the age of 18 years and any mother who is above the age of 35 years will always end up having a premature baby. No, this is just a factor, predisposing factor. Okay, not everyone can end up having a premature baby with those ages. Okay, another factor under the maternal that we can look at is socio-economic class. So when you're looking at socio-economic class, this one it leads to malnutrition. Of course, when you're looking at malnutrition, it means the baby obviously is not receiving enough nutrients, and therefore the baby will end up being born as a premature, because this baby is not receiving enough nutrients. Another maternal factor that we can look at is uterine abnormalities, such as a fibroid uterus. Now, a fibroid uterus results in diminished space, resulting in premature birth. In our next video, we're going to look at the fetal factors, the placental factors, and the iatrogenic factors.